Healthy choices, helping you live healthier. Sponsored by Intermountain Health.
Welcome back to Good Things Utah. Across the nation, preterm birth rates are on the rise, but Select Health's Healthy Beginnings program aims to reduce the risk of preterm birth rates and increase potential for healthy delivery. Joining me now for the sponsored interview is Vicki Adler with the Healthy Beginnings program of Select Health and program participant Allison Pope and her baby, what's his name again? Elliot, who is almost 5 months old and the cutest thing we've ever seen. Okay, Vicki, let's start with you. We are seeing preterm birth rates not just locally but all over.
Right. Nationally, it was about a 4% increase between 2020 and 2021 nationally. And here in Utah, we're at about 9.9%, so just a little bit lower than the national.
And many factors contributing to this, but Intermountain wants to do something about it, and that is the Healthy Beginnings program. Will you describe what that is?
Absolutely. So the Healthy Beginnings program is a maternity care management program. If you're part of Select Health and pregnant, then you have access to caregivers and nurses in particular that will walk you through the pregnancy, make sure you're getting the appropriate care in the appropriate place, answering questions, providing education.
Let's bring you into the conversation, Allison, as a first-time mom choosing to go through this program. What was the reasoning behind that, and how did it help you?
It was just, being a first-time mom, I didn't know really what to expect. Like, my youngest sibling he's now graduated high school. He's 19, I think, so it's like, I don't even remember when he was a baby. So to think about, like, what to expect for myself, like, I didn't really know a ton of people who had recently gone through it. And so when Vicki called me one day, she's like, hey, we have this program. I'm like, sure, the more people I can connect with to help me along, the better. So
I hear you. The first time going through it, there's a lot of unknown, there's fear, there's anxiety. Do you feel like those things were alleviated and questions were answered? You had support?
Very much so, very much so. I was able to, I didn't have a ton of concerns really. It was a really simple, easy pregnancy the whole time for me, but any questions that I did have, it seemed as soon as they were popping up in my head, she was calling me a couple days later just as the regular phone call, and it's like, oh, by the way, I have this question. She was able to help me along the way.
Every woman needs this. Even if it's maybe a second time and it's been a few years, you might forget how it was to go through it. Vicki, will you talk about the resources and tools that are offered?
You bet. So we have educational information, a packet of information that we mail out. There's a couple of incentives. It's really important to get into those appointments with your provider. So we have a couple of incentives for that. And we just have that access, to talk to a nurse when needed. It's that extra layer of support besides the provider, and kind of just a resource to know, is this something that's concerning, or should I not be concerned about that? That's a really big deal, for our moms, is knowing, when they need to seek care and when they don't.
Yes, that's a huge one, just crucial. Will you talk a little bit more about the incentives, what that entails?
You bet. So what we really want is for moms to get into that first prenatal appointment and get established with their provider. And so we offer $25 for in gift card or cash form, depending on the plan, to get into that first appointment. And then after delivery, of course, is super important to follow up and make sure that you're emotionally feeling well. So we offer another incentive for that postpartum visit as well.
I love what you are doing and offering women in our community. And will you tell me, now that you have your beautiful little boy 5 months out, what would you say to a first-time mom with the same fears that you had, that same unknown about going through the program?
That you should definitely do it. Definitely. It's just a huge relief to just know that you always have someone in the corner that you can always call. Like Vicki said, it's nice to have someone that's like when to seek help versus when it's okay to just write it out and it's fine. Because, on top of the pregnancy itself, most people are probably worried about finances. It's not cheap to have a baby. And so it's like you don't want to add any more doctor's visits to have to pay for something that's just, not a huge concern that you're just going to walk away. It's like, it's not a big deal, and then have to pay for it later. It's a lot easier. Hey, is this something that I should go get checked out? Or am I like just overreacting and freaking out?
That's such a good point that you bring up too. All right, you have thought of everything. This is wonderful. Thank you for all that you are doing. And thank you for introducing us to the cutest little boy. To learn more about the Select Health, the Healthy Beginnings program, and to enroll, just visit selecthealth.org or call the number there on your screen. We will link to all this information as well. Thank you both so much.
Of course.
We'll be right back.